Thank you, Matthew. Good morning, everyone. Can you hear me?
Yes.
Yeah.
Nice to see you all. Alfonso, could I have my slides, please? I'll just walk through an update of where we are currently with our numbers in Marin County, and then get into some of our key strategies for this week. And then I'll be available for questions. Next slide, please. So this is the cumulative cases we've had in Marin County since the start of our experience of the pandemic in early March. We've had a total of 4,557 cases so far cumulatively. Next, please. This slide shows our epidemic curve. When we talk about flattening the curve, this is that curve. It's the number of new cases per day. And this is by the day that they were tested. And what you see here, if you sort of take a step back and look at it generally, you see a clear epidemic that peaks in July for us in Marin, and has had a relatively steady decline since then. We have the last week, we had a total of 66 cases, I believe, which is the lowest number of cases we've had, 68 cases, the lowest number of cases we've had in a given 7-day period since May. So a sign of progress. But again, we also need to recognize our ongoing vulnerability, and we'll talk more about that. Next, please. This is our overall percent positivity, and this is something that we are tracking daily because it's become an important piece of the metric that the state is following to determine which tier we fall into. And this is also one of the lowest percent positivity we've had in several months, another sign of progress. Next, please. These indicators are incidentally, these are screenshots of what's available to the public anytime anyone would want to look at coronavirus.marinhhs.org, and they're updated each day at 4 o'clock in the afternoon. This is the number of individuals in Marin County who are in the hospital. And at 4, it's another sign of one of our lowest numbers we've had. This is the lowest I think we've had since May as well on any given day in the hospital, for total one in intensive care. Next, please. And this looks at the hospitalization rates per capita across the Bay Area. On the right there, you see all of the different counties that are represented in this, and then the number of people per capita, not per case, within those counties. And what this shows is that Marin has currently the lowest hospitalization rate of any Bay Area county. Next, please. This breaks down our cases by race, ethnicity, and has been an important feature of our experience of the epidemic ongoing. The most important feature here is that on the far left, you see the baseline prevalence within Marin County of people of different race, ethnicity that make up our population. And 16% of our population are people who identify as Hispanic or Latino, and make up 67% currently, a full 67% of cases. Importantly, last month, that was up to 80% of our cases. So we're seeing progress in reducing the incidence among our Hispanic and Latino community. That proportional difference is not because we're seeing more cases among white people or people of other race ethnicities, but rather progress in reducing the incidence among that particular community that's been hardest hit. Next, please. This is the breakdown of cases by age. On the far left column, you see the breakdown of our population as a whole in different age groups. And what's important here is that highest, at the top of the columns, the green bars, which represent the oldest age groups above age 65 or older, while they only make up about 21% of our population, make up a full 95% of people who pass from COVID-19 in Marin County. And we've had about 85% of those deaths are among people who are living in long-term care facilities, either skilled nursing facilities or residential care facilities for the elderly, which has been another important guide to our strategic response. Next, please. And this just offers more specificity to that. This breaks down the cases by age over time. And what it shows is that, as the epidemic has progressed in Marin, we've had really an increasing proportion of our cases that are among people who are age 19 to 49, which goes along with the fact that much of the transmission that's occurring within Marin is happening among our essential workforce, those people who are in that age group, and then their households. Next, please. So now I'm going to get into what this means for us in terms of our tier as a county. As you know, the state has launched a new framework, the blueprint for a safer economy, which organizes every single county in the state according to their incidence and new cases per 100,000 residents, and their percent positivity among those that are tested. We are currently in tier 2, that red tier that's circled, indicating substantial transmission. We had been in that purple tier, the first tier, widespread transmission a month ago. And that's because our case rates dropped from above 7 to below 7. Our case rates currently land us in that substantial tier. And I'll go through the numbers in a bit. Next, please. And then just a reminder that that tier status is what designates what can or cannot be open in terms of businesses and schools. And this is the key. That I won't go through this, but this is the key of the different sectors that can be open at different points. What is important about this is that if you see in tier 3, those things that are allowed in indoors in tier 3 are really mostly just an increase in the capacity of things that had already been opened in tier 2, moving from 25%, for examples, in restaurants to 50% capacity. And we may be headed towards tier 3 in a matter of weeks, and we'll talk about that shortly. Next, please. So this is the current tier assignment for Marin County. On the left there, you see the state. What's interesting about these board meetings is they happen in the morning on Tuesdays, and at noon on Tuesdays is when the governor announces our new status. So I'm offering you provisional, but I'm secure, I think, in our status, because I'll offer you information as of yesterday in terms of where we are with our tier. So this is on the far left is the state as a whole. On the right is where we were assigned, and it's visible on the website now, at the state website on September 29th, last Tuesday. We are in tier red with 5.7 of the adjusted case rates. Again, we need to be between 4 and 7 with a 2.9% positivity. Next, please. So these are anticipated tier assignments for this coming week. We are anticipating to remain in red tier 2 because yesterday on October 5th, our adjusted case rate was 4.3. So significant improvement over the rate that we were assigned last week, which was 5.7, with an overall positivity of, as I already mentioned, 1.8%. And then a test positivity in the lowest HPI quartile. HPI stands for Healthy Places Index. And I'll talk about that in a minute, but this is something that we'll be continuing to report and track because of the new health equity metric that's been added to the criteria for moving through the tiers. And for us, that positivity rate right now is 3.0. We need to be beneath 5.2 in order to continue to move forward. So we're secure in that metric currently. We've been in red tier for 3 weeks. If it's confirmed this afternoon that that's where we are. Which would mean that the earliest potential move into orange, tier 3, would be October 27th. And that is, and only if, case rates are below 7 and our positivity rate is below 5% overall, and our positivity rate among that lowest HPI quartile is beneath 5.2%. Only when all 3 of those conditions are met for a period of 2 weeks straight would we be able to move forward on October 27th into orange. The earliest potential, and it's obviously no guarantee that that's the direction we are going, because we are, again, vulnerable to also losing some of the gains we've achieved if transmission increases. So we could also move back into the purple tier, and the earliest that would occur would be October 27th. Again, because we would need 2 consecutive weeks in that other tier to actually need to move in that direction. And that would be if our case rates were above 7 or our positivity rate were above 8% overall. So either of those two things independently would lead us to move back into tier 1. Next, please. So this is the health equity metric. The state had a webinar yesterday that clarified how they're using the health equity metric, and I thought I would just share this with you in our community. And it basically determines, it's a new indicator. Before we had only been looking at case positivity rates and total case rates. Now we're also focusing on making sure that our lowest income communities, our most marginalized communities, which are also those communities that have the highest burden of COVID-19 prevalence across the state, are not left too far behind as we move through the tiers. And they're looking at percent positivity to make sure that our percent positivity is not too high in those communities before we would move forward. So we are in that second row there, substantial. So we are in red. For us to move into the orange, which is moderate, we would need to have less or equal to percent positivity among our lowest income communities of less than 5.2%. As I said, that rate now is currently 3%. So we are we're secure in that particular metric. And then when and if the time comes for us to move from orange into yellow for moderate into minimal, we would have to have a percent positivity in that lowest income group of less than 2.1%. Next, please. And I'm referring to the HPI census tracts as really income, but it's more complex than that. And I just want to let you know what the Healthy Places Index actually is. It's an aggregate. It's a way of describing opportunity for health in a more holistic way. So and these are all the factors that go into that assignment. So every county is divided into quartiles for this equity metric by census tract. And so we have 14 census tracts in Marin County that are in that lowest quartile, and I'll go over those shortly. And the way they are tiered is by looking at all of these different indicators that you see here on this slide. So looking at economic opportunities, those which includes average employment, the percent that are above or below the poverty level, income, and then and that's weighted probably the strongest of any of those. Then they also look at educational attainment, those that are in high school, those that have bachelor's degrees, opportunities for transportation, automobile access, the proportion that had voted as a sign of being connected, and then other factors relating to the neighborhood in terms of park access, supermarket access, then housing opportunities, the environment in terms of environmental exposures to air pollutants, for example, and then healthcare access. And those are all factored into again a holistic view of at the community level, at the census tract level, what are those communities that tend to have the least opportunity for health? Next, please. So in Marin, those 14 lowest quartile census tracts are 7 are in Centerville, including both canal area census tracts, Marin City, parts of West Marin, and parts of Novato. And we will share on our website what specifically those census tracts are. Sometimes they're just tracts, so we need to, we just learned what they were yesterday. Define them in the ways that we think of the neighborhood, so people understand where they are, and we'll offer a map for where they are. And those communities are already the focus of ongoing outbreak prevention and mitigation strategies. As part of the Health and Human Services health equity strategy that we've been advancing, since I've been a health officer here, and then accelerated with the arrival of Benita McLaren and the health equity officer, Anya Muse. We've been doing a lot of work in these communities already. and our COVID-19 strategy has really has built upon that. So we were, relieved to see that when this equity metric was introduced by the state, it really was more just a reinforcement and an amplification of our existing strategies. And again, the cumulative percent in those communities right now is 3%. Next, please. Briefly on schools. So according to the state blueprint, after 2 weeks in tier 2, and now we're in the 3rd week, schools may reopen to classroom-based learning following state and local guidance. And that would be for TK through 12 and higher education. The earliest would have been September 29th. So we're now into that interval where they are able to open to classroom-based learning. Prior to that, 32 schools had received waivers to reopen prior to September 29th through an approval process from my team that was limited to TK through 6. And that had totaled approximately 4,000 students, or about 10% of the total student population. We have about 40,000 students, or people of student age in Marin County. In tier 2, a school site specific protection plan still must be submitted to public health for review prior to in-person learning. And we have been reviewing school site specific protection plans that outline those 30 different elements that we think are so essential to reopening schools as safely as possible, both for students and for the adults that serve them, the staff and the teachers. We've had no cases among open schools as of October 5th, as of yesterday. And we are building a public dashboard for tracking schools. This is obviously a matter of a lot of public interest and concern. And we want to make sure that we're tracking this as closely as we can. So by the end of the week, we should expect to be able to have on our website, shared with the Marin County Office of Education, a dashboard that shows all the schools that are open, those and the cases that we're seeing in those communities when we see cases, because we expect that that will occur. We are experiencing a pandemic. Our definition of success will not necessarily be 0 cases, but really finding that appropriate balance of making sure that we're addressing the harms we know are associated with a purely distance approach with minimal transmission within the school setting based on adherence to the safest possible standards. And you'll see that dashboard that anyone can follow. Next, please. So this is, I think, one of the fundamental questions for us as a community. On the left there, you see our wave. And the question is, will we see a second wave? And I'd like to just, frame this as being up to us. We do have control over our behavior. We know what it takes to prevent COVID-19 transmission. The fact that we've had the success we've had so far is a sign that we know what it takes. And it's not complex in many ways. It's obviously challenging, especially as the months wear on. But we know that covering our faces, maintaining physical distancing, washing our hands, avoiding others, avoiding gatherings is the way to continue to make progress. And if we see a second wave, it will be most likely because we failed to continue to adhere to those standards that we've already demonstrated are necessary for the success we've already had. And so let's make sure that we don't make the mistakes that seem to be occurring in other parts of the country now, where as people relax, they're starting to see increases in cases. We're still seeing improvement, but it is not a sign that we can relax our strategies. Next slide, next, please. And there was a vivid example of that, and I've been asked to comment on what's happening at the White House, and obviously it's strongly sort of political overtones on this, but just to take it from a pure scientific standpoint, this is the gathering, a photograph of the gathering as it occurred at the White House, and what we see is what maybe it's a sign that, and then on the bottom of this slide, what you see is the number of individuals who were infected, who are within that setting known so far, and this can be a sign that is not, if you look at how close people are gathered together in the absence of masks, we see it as a sign. If there's any lessons from what's happening there, and I think there are many, but I think the most important is that we're really not ready yet for gatherings that look like this. And I know that in Marin, there's been a lot of questions about, we've heard questions of people who want to have weddings and fundraisers and other events that are, obviously things that are so important to us to begin to resume as soon as we can as a matter of the quality of our life. But being physically distanced, being outdoors, covering our faces is essential. And we're not ready again for gatherings that look like this. Next, please. Flu. This is my last point, which is we need to prevent the twindemic. Just a reminder that flu admissions annually fill Marin ICUs. That may be something that people don't fully appreciate, but our healthcare providers know well that every year flu stresses our healthcare system. Emergency departments go on diversion, which means they're saturated. They can't take more patients. We have regular occurrences where either Marin Health or Kaiser or Nevada Community Hospital might say, the next ambulance ride needs to go to a different hospital because we don't have the capacity right now to manage the next person. That's called diversion status. It happens a lot more during flu season because of the incidence of respiratory illness. And it's not uncommon for the intensive care units to be full and for people who need ICU level care to be actually managed on medical floors with ICU nursing and ICU care because the unit itself is full. And that's a regular occurrence during flu season. It doesn't get a lot of media or awareness, but we certainly can't manage that reality at the same time as we might be having increases in COVID-19 cases. And everyone can do their part to protect us by getting their vaccine. That's the good news about influenza. It is that it is vaccine preventable and the vaccine is safe and effective and available. And so that's my wish and my ask is that all of us do our part this year, especially to protect ourselves against influenza by getting vaccinated. And of course, the practices we're doing to protect ourselves against COVID-19 will also protect us against influenza, masking, physical distance, hand washing, staying home when we're sick. We are looking for influenza when it comes. It comes every year. Usually it's around December. This year we are now combining, we have a research effort with UCSF, where a certain fraction, a random sampling of the COVID-19 testing that we're doing in Marin is also being tested for influenza. So it's a combined diagnostic test that will give us more intelligence, better surveillance for early detection of when influenza starts circulating in our community. And obviously, we're also doing surveillance for respiratory illness. All of our 911 calls and all of our emergency department visits that are related to respiratory illness, we put that surveillance process in place for COVID-19 to detect surges early, and that will also help us determine when we're seeing surges in flu cases. Next, please. So get your flu shot. Next. So to summarize, we're seeing significant progress. Our case counts, hospitalizations, percent positivity rate are the lowest they've been in about 4 months. I see this as a success for all of us, that it shows the power of the collective measures that we've been adopting, especially in your personal behaviors, as well as some of the work we've been doing to enhance testing. We have some of the highest testing rates in the state, and testing in the communities that need it most, and then contact tracing. We are vulnerable to slipping back, especially because tier 2, and then if we move into tier 3, allows us new activities indoors, which increase risk. We're monitoring closely, especially as some schools are carefully reopening. And we want to make sure that everyone remembers to get their flu shot. Thank you.
Thank you, Dr. Willis.